We just finished up Chapter 2, Section 2, and we're on to a little bit of a debate section. And we're going to talk about one of the most controversial and probably one of the most confusing debates that are out there in society today, and that is the debate whether or not healthcare should be a right or a privilege, and if it should be something that we buy in the private sector or something that the government should provide. Now, if you look at America, again, as we've talked about before, we have a mixed economy. We have a capitalistic state where we have a free market which determines our prices. At the same sense, we also have socialized aspects of medicine or Medicare. We have Medicare and Medicaid. Medicare is health care for the elderly, and Medicaid is health care for the poor. Both of them are subsidized by the taxpayers in the United States and therefore have a socialistic aspect. So you hear a lot of politicians out there constantly saying, we should provide health care for everybody as a certain right or responsibility. So to start this off as a discussion, because again, it is controversial, I just wanted you to think about a few questions before we get into the nitty-gritty, and we have a little bit of a research project to do. So what happens when someone is seriously sick or injured? What happens to them? Can they financially afford it? Do they have health care? Do they have a savings plan? Who pays for this medical care overall? And what happens if someone can't afford that treatment? Or if they don't have insurance? What's really going to happen to these people? So, do you as an individual have health care savings plan, or does your family? So, I want you to think about and prioritize what are some of the reasons that we typically save money. At your age, you probably are thinking about paying for college or maybe buying a car. In the next few years, you might even be talking about purchasing a house. But why don't most people save for health care? And the answer is, we don't think we'll need it. We think at this age, and it's a luxury, and that nothing's going to happen to us. We're indestructible. So what I'm going to do is I'm going to pull the class. We're not going to obviously do this on the video, but I'm going to pull the class and figure out, do you think right now, before we have the knowledge and background information, do you think the government should provide health care? Here's an overview of the situation as it exists today. Some 47 million Americans currently live without insurance to cover the cost of their health care. About 80% of them come from poor working families. Just 2% of the uninsured, mostly healthy young adults, have no health care insurance because they think they don't need it. The prevailing view among this age group is that health care insurance is expensive luxury that they can do without. Most Americans agree that everyone should have access to affordable health care coverage. However, they disagree on how to make that happen. Some reformers call for the government-paid health care system by taxes. Others believe that free markets, driven by consumer choice and competition, can deliver health care at the lowest possible cost. The role government should play in providing health care for all Americans remains controversial to this day, despite the fact that every other industrialized nation has long had some form of universal health care. Again, even when we had the Universal Health Care Act or Obamacare that we've talked about, the Affordable Care Act, it doesn't necessarily mean that everybody is covered and that we cover things in just a different way. So there's a few arguments that are out there, and these are two major arguments that we see. We're going to look a little bit more and investigate them from a factual-based website analysis in just a few moments. But the government should provide health care. Medicare could pay about 30% less to doctors and hospitals, and everybody would get better. But it won't happen on its own because one person's waste is another person's revenue stream. That's why we need to cop on a beat and only cop with the clout to get healthcare industry to play by the rules is federal government. Meaning that, again, if the federal government regulates the prices, the services, and aspects of healthcare, then we'll be able to make sure that we have everybody provided with the basic coverage, where some people would have to pay more because they have more income. They would be provided with that basic coverage to start off with. And if we look at or analyze the graphs here, this is where Americans get their health care insurance from now. You see that most insurers or employers, insurees, are insured by their employers, about 49% currently. 13% by Medicare and 16% by Medicaid. So just about 29% is covered by public or government-run plans. Again, this is prior to the Universal or Affordable Health Care Act. We still had about 16% uninsured in our country, and other people have an individual policy. So everybody has some sort of access. It's just whether or not they can afford it or not. And the problem is people in this group right here, this uninsured or underinsured, they don't have it offered from an employer's plan, and some of these people just make too much money to afford or haven't met the requirements of Medicare and Medicaid, which is what's controversial. Besides that, there's other points of view. The second point of view is the government should not provide health care. I'm going to read this statement from Claire Booth from the Luce Policy Institute of the Policy Express paper, and the article is Who Should Pay for Health Care by Sally Pipes. Imagine that you paid for an annual fee to get all of your meat and fish at one market. There was no limit on what you could take to use. The easiest way for the grocer to keep costs in line with the annual fee to discourage waste, abuse, or overuse would be the ration availability. This form of rationing is often used in government single-payer healthcare systems by limiting the number of costly medical procedures available by forcing patients to get on a waiting list for them. And what that says is that if the government has too much power over the healthcare system, then therefore they could tell you what you can or cannot consume. Meaning that you as a consumer, if you had a problem that you wanted to have fixed or addressed by a doctor, you would have to wait in line, and the government would have to say you can or cannot get this done, creating more bureaucracy or things that are going to get in the way from you getting the best healthcare service that you can provide. Now again, that's not saying that either side is correct or right or wrong at this point. The arguments are both very, very strong on looking at the aspects of what would be there. But what we see is we have a trend, and what you look from is from the 1960s up till 2007, before the passage of the Affordable Health Care Act. You saw that the government growth in healthcare, meaning that we were growing the amount of people who were public or who were provided public health assistance by the government. At the same time, the amount of people who had purchased private health care or private medical condition health care was actually going down on the decline. And at some point in the near future, at this rate, we were going to have more people who were going to be provided health care by the government than by private sector. So in looking at, you see there's four main arguments for and against health care. Look at the first argument for. The first thing says more people would have access to affordable health care. That's obviously a good thing. The more people would receive care before serious problems develop that are expensive to treat, meaning that if you treat a patient in advance, the costs are going to go down. So if you have someone who became obese and was heading towards having diabetes, having that preemptive medical care, advising the patient on better ways to treat themselves or to diet or exercise before diabetes is actually started would probably help that person and then drive the costs down when you're talking about things like type 2 diabetes or heart conditions of that nature. Healthcare will become more efficient as another argument for, because if everybody had access to it, you would have more people in the market, meaning there would be a bigger demand for nurses and doctors and healthcare professionals, meaning that you would create a more efficient system where everybody would have access no matter where you lived or what you could afford or not. And healthcare would be less expensive. The whole idea is that if everybody is required to have it, you're not covering or you're not paying for people who don't have it. Meaning that if you look at the cost of prescription drugs or even medicine in a hospital, if you go to the emergency room and you don't have insurance, most hospitals are not going to turn you away. So even if you can't afford to pay it, the hospital has to find a way to cover their loss, meaning that they're going to give you that Tylenol and they're going to probably charge you out the wazoo, but in the same sense, somebody else is going to pay it. They're just not doing it as a charity case. So what they're doing is they're going to raise the prices for everybody else because they need to cover those who are not covered. There's also some good arguments against on the right side column. First thing says the government paid health care raises taxes and reduces consumer spending. What means is if everybody's required to pay money out of their pocket to buy health care, they're not stimulating any type of workforce besides the workforce in the healthcare industry, meaning they're going to have less disposable income to go and spend on other things in the free market, which is a very valid argument. Government healthcare care leads to rationing of service. Again, like I said in the last slide, was the whole idea that if the government has total control, they're going to be able to regulate and tell you what you can and cannot have. But also, I mean, from that perspective, I know the regular healthcare industry does that a little bit too, meaning that you have to have approval or have to have other procedures before you can have those other procedures done. The wait for healthcare services will increase, and what they're saying is if everybody has access to healthcare, then more people are going to use it, and it's going to cause more waits for the average person, which doesn't have to wait in line right now. And finally, the government health paid system encourages patients to seek costly services, meaning that when you see patients who didn't have health care before, now entering a flooded market, they're going to see that they're going to have the ability to use the same type of healthcare system as people who are perhaps wealthier or better off, and therefore they're going to go after these more high-risk or high-paying procedures that are going to actually raise costs, because if everybody's spending a lot of money, then the premiums would go up depending on how the government would regulate those such premiums. So, as an activity to end this up and end this discussion, I want you to go on with a partner to the next slide, and it's going to be a graphic organizer. I want you to list down the 3 major problems that you see in the system today. Those problems can be the arguments for or the arguments against. And what type of solutions are there out there to try to address each of these issues specifically? Meaning, pick one of the issues that you see, whether it's for or against, and how could you or the government solve that problem? Afterwards, I'm going to have a paragraph that I'd like you to work on by yourself. You're going to go to to procon.org/healthcare, which is listed on the worksheet attached on the website. And it's going to ask you to look at, there's 12 major arguments for and 11 major arguments against, which are the ones that you hear all the time of, should we provide health care for people and should we not? And I want you to, as we're looking through and reading these articles, I want you to go back to this just for thought. What happens when somebody is seriously sick or injured? Who pays for the medical condition and the medical care? And what happens if someone cannot afford that treatment and does not have that insurance? So take a few minutes, review, and I'll be talking with you soon.